go.
Good afternoon, Dr. Eckstone, classmates and guests. Thank you for your time and attention in this matter and for considering my viewpoints on lowering carbohydrate intake. Wouldn't it be wonderful to have good health and proper body weight without exercise? Well, follow me as I will show you that it is possible. After eating, we often feel fatigued and sleepy. Sleepiness has grown continually more common in the United States, according to the Center for Disease Control and Prevention. While sufficient night's sleep is key to daytime energy and alertness, our diet can play a role as well. Carbohydrates are your body's main energy source, but they can also work against your wellness and energy levels. In addition, carbs affect body blood sugar, causing fatigue after you eat foods containing them. Your digestive system breaks down the digestive carbs which enter your bloodstream. As blood sugar rises, your pancreas produces insulin, a hormone that allows your cells to absorb the sugar. In response, your body produces hormone glucagon, which helps to keep blood sugar and energy levels in check. There are two types of carbohydrates, simple and complex. Simple carbs, the bad ones, such as cane sugar and high fructose corn syrup, cause your blood sugar to spike up more rapidly. Slower moving complex, the good carbs, are prevalent in starchy vegetables and whole grains. The rapid spike from eating simple carbs, particularly in excess or without other foods, can cause blood sugar to plummet back down, leading to that groggy fatigue feeling. Carbohydrates provide 4 calories per gram. The U.S. Department of Agriculture recommends healthy adults limit their consumption of carbs to between 45 and 65% of their daily calories. Consuming too many carbs can increase your risk of several disorders, including type 2 diabetes and cardiovascular disease. A diet containing too many carbohydrates can raise your blood level or triglycerides, a type of unhealthy fat that travels in your blood. It can also lower your blood levels of high density lipoprotein, often referred to as good cholesterol, according to the Linus Pauling Institute. High triglyceride levels, along with relatively low levels of high density lipoprotein, can significantly raise your heart risk of heart disease. A high carbohydrate diet can also have negative effects on your blood vessels. A clinical study published in the Journal of American College of Cardiology showed that when healthy subjects consumed a high carbohydrate meal, especially one containing foods with high glycemic loads, their arteries became rapidly enlarged. The research concluded that over time, this effect could damage artery walls and lead to other vascular disorders. When planning your daily diet, follow the 2010 dietary guidelines for Americans and consume a total number of calories consistent with your age and lifestyle. Limit your total consumption of carbohydrates to 65% of your calories or less, and choose mostly carbs with a low glycemic load. These include high fiber fruits such as apples, pears, citrus fruits, and berries, and most vegetables with the exception of potatoes. Potatoes have a high glycemic load. Choose bran cereals or whole grain breads, pasta and baked goods, and cooked grains such as rice and barley. Beans are also good choices with a low glycemic load. Avoid foods with high glycemic load. These include foods made with refined flour and those containing added sugar, such as candies, sweetened sodas, juices, and sweetened desserts. If you want to feel better, prevent certain diseases, and maintain a healthy body weight, reduce your carb intake. I encourage each of you to lower your carbohydrate intake and take control over your health. Now, this is the question and answer time. Do we have any questions? Please feel free to ask any questions pertaining to this subject. Also, I will remain in the room after the presentation in case you want to discuss more privately. At this point, I will close the presentation. Hopefully, I have inspired you to consider my views and possibly reducing your carb intake. Thank you and have a good night.